Hello everybody, Maria, Trusa, and
Gina Capelli.
Reflect and Reset with Maria and Gina. Thank you so much for joining us. We have a very interesting show today. Gina?
Yeah, we're late, but
we're
only
late,
because
yes.
Our special guest, Dr. Midelton,
Our medical director
and internist here at Formé, was seeing patients till late. So we had to get a little bit of a late start, but we have a great show because we're going to talk about medical marijuana. And Dr. Midelton just got certified to distribute or to prescribe medical marijuana, and we were able to go, him and I went over to the dispensary right here in White Plains, and we learned a lot. So we're going to talk a little bit about what conditions he would see, how they book your appointment, and
because as you know, our mission is really to figure different ways, alternative ways to help all of our patients. And that is one of the reasons, the main reason you got certified, and we're very blessed that you did.
Yes.
So let's talk about what kind of patients would you be able to see and help?
Well, first of all, there's a big interest in it lately. Part of it is because they're trying to legalize it, and it is legal in a lot of states. It's illegal, as everyone knows. California, I think California is now legal. It's Colorado, Connecticut has been dispensing it for a few years, and New York has also been dispensing it now for a few years. Although not as long as Connecticut has. So there's a lot of interest in it because it is considered an alternative to medications, and they think and they agree that it does help with a bunch of conditions. For example, it's known to help epilepsy, post-traumatic stress disorder. It can help with ulcerative colitis, Crohn's disease, chronic pain, neuropathy. So there are a host of conditions that it does help with. Part of it, I think also there's a big interest in it. I sort of read this, I'm really inferring, is a CBD oil is just so popular. I read a week or two ago that it's probably one of the most sought after products. You can get it without a prescription, and it's one of the most Googled search terms. Is CBD. And everyone is using it. And of course, marijuana and medical marijuana has both the THC component and the CBD component. So and they're different. And when we prescribe the medical marijuana, you could have something the product that's all THC with very little CBD, and then you can go all CBD.
Right. But they also said they start you very light.
They start you light with the THC because that's the component of the medical marijuana or any marijuana that actually gets you high. The CBD does not, but they're both in it. So and then at the dispensary, as you said, they start you at low THC, and then they can gradually progress you as you need to be.
Right. So. And how many times I think we decided that it's probably best for somebody to come back quarterly, right, to see you. So if you prescribe, some people want you to come back every month, but we felt that it would probably be best for Dr. Midelton to monitor how you're doing on this, so they can continue to renew the certification.
Yeah, it is controlled, just like any other controlled substance. So we can't just give a certificate and say, see in a year. We don't do that with any controlled substances. So the quarterly really makes sense.
So this is monitored, like they do with any of the opioids. So they know exactly what you're on, and it's auditable.
Yes. So you go into the prescription.
Yes, and it shows up. Yeah, we go into the state of New York prescription monitoring program, and it'll show up that it was dispensed. And for any state, it'll show up.
Right.
And who gives the dosage? The dosage is made by the dispensary?
Yes. Yes.
Okay.
Usually what will happen is the patient goes to the dispensary, which conveniently for us is about 2 blocks away.
Yeah, 2 blocks away.
And they sit down, they consult with the
pharmacist,
and they describe their symptoms, and this is what goes on pretty much in most dispensaries. And they will have a conversation about symptoms and what the patient's goals are, and they'll pick something, and then they see them back later on, how they've been. If there's any problems, they could call the dispensary, of course. They could also call for any adverse reactions. They could call the dispensary or myself. But it's really the people at the dispensary, the pharmacist, that is going to decide the ratio of THC to CBD, right. And of course the form, because it comes vaporized, and there's also edibles.
Nasals.
Yeah. Well, I don't remember nasals.
Yeah, there's a nasal spray. There's the vape.
There's the
and
vapor.
Then the pills.
And the pills.
So how do we deal with like the patients? If you are working and you get tested, if you have a certificate from you, it's okay?
It should be.
It depends on.
Well, we give them a letter like anything else. That, if someone was on a benzodiazepine, they would get flagged if they were at work. If they were on an amphetamine, they would get flagged either way. And as long as they have a certificate or a letter
and they go to HR. The guy said you should go to HR, let them know that you're taking this for whatever the condition is.
So it's not a surprise to anybody.
Right.
And like any other medication, it would certainly, that medication would show up in a urine drug screen, but as long as everyone's aware, should be no issue.
The other interesting thing we found out is that Dr. Midelton can prescribe it here in New York, but you cannot cross state lines with it. It's a New York-based medication.
So if I'm from Connecticut and I come here and I get it, I cannot take it. Well, Connecticut, you said maybe it is legalized.
Maybe because it's legal, so you have to know what the laws are. Right.
So, but you can't come and get it here and then take it.
You shouldn't.
No, you shouldn't.
And it can be confiscated at an airport because those are federal agents.
Yeah.
So even though I forget how you described it, but and I read it before, because we're actually skirting federal law by somehow. It's being declared legal without actually being declared legal.
Yeah, so it's state by state.
And it goes state. So it can be taken from you by any federal agent in TSA in the airports, where they're federal agents.
And they can actually arrest you.
Yeah.
Even if this is important for people to know, because when they're traveling, then they cannot use it.
No.
They should be very careful, and they would say it's going to be up to the discretion of the agent. I mean, just like if you get caught speeding, it's up to the officer or trooper who, if they're going to give you a ticket, it's going to be up to the officer if they're going to confiscate it from you.
Wow.
Yeah.
This is interesting. And for patients that suffer from anxiety, do you think CBD is the answer, or if it's, what was your opinion on anxiety and this medication?
I don't really know. It doesn't specifically have an anxiety
diagnosis.
Indication. It's specifically for post-traumatic stress disorder. So they do think that it is useful for that. I've met patients from Connecticut that are using it specifically for that, and they swear by it.
We swear by the CBD.
Yeah.
It calms me down and helps me sleep. I rubbed it on the pain that I had.
It was interesting. I really, for a long time, I resisted doing it, but there are CBD receptors in your whole body.
Yeah.
Your entire body has these receptors, which made me think, okay, we have God made us, God made the earth, and here we have a plant that will affect all these CBD receptors, and it really made me think twice about,
because I remember at the beginning,
why we're not using it more often. There still is a lot of research to be done, but it is incredibly interesting that there are receptors in every organ in your body.
It's also knowing where you're getting it from.
That's
It's
true.
just like anything else. It's like going to buy a pot off the street. You don't know what's in it. And, you know, you have to be really careful, so you have to be with a reputable company. And that's why these dispensaries are
Yeah.
really the best place, because they're federally, you know,
Right, they're
safer,
regulated,
regulated.
everything is,
Right.
like no herbicides, it's grown in a very controlled environment. Everything is pure and fresh, but it is oils and gummies and sprays and things like that. I know in Connecticut they actually sell the actual plant itself, the bud itself, but New York doesn't do that, but it is what it is. That's what we have in New York right now.
And so, you know, if you are suffering from any of these issues, you know, you should let us know. If you want to come see Dr. Midelton, you should need to let us know why you're coming in, because it's a totally different type of visit. A lot more different information that you would need to intake, and so we're actually allotting space and time for Dr. Midelton to see patients that are
And we will
in
get
need.
inspected by the DEA.
Right.
They come in and they will be inspecting us.
Yes, that's why we need to understand why you want
Everything
to
has
visit.
to be very well documented.
Yeah.
Yeah, this is very exciting because it's new. It's a new way, and I know that it's a new way that I guess for us is new, but it's been done in Colorado, right?
It's recreational and medical over there.
Yeah.
And California is both.
Connecticut.
You know, this is just, we're not recreational.
We're not
here.
recreational.
So this
Yeah.
has to be for conditions that Dr. Midelton was talking about.
So now, if you're interested, obviously you can call the office. We are ready to be able to take care of you. People with chronic pain and back pain, because that's a big issue. Like so many people. I was at a meeting at White Plains Hospital, and I was talking to one of the case managers there, and she was telling me how she has horrible back pain, chronic pain. So somebody like that, should they try to?
Yes, not only that, they're also using it to help, believe it or not, wean off of opioids. You know, there's been a big push to, you know, I think in the 80s or 90s, they were telling us to give everyone pain meds, and everyone gets hooked on opioids. Now they swung in the opposite direction, and I think what they want us, what they would prefer us to do, and I personally would prefer to do, is give medical marijuana over opioids. And what happens is when people take the the medical marijuana, they seem to, after a while, they take the opioids less and less. So it ends up replacing it. And you know, it's not addictive, and the side effects are, if there, I mean, there's anyone who's ever smoked pot, there are very few side effects to it.
I've never smoked.
There's very few side effects to it, and you know, when you're not dealing with something that really is addictive.
Right.
So you can get off of it. It can help your pain. You can take it when you want to, when you need to, rather than your body is craving the opioid, not even so much for the pain, it's just craving the opioid, and then you've got to take your Percocet or Oxy or whatever else you're taking.
And the feeling that you get from those medications, I mean, I've been sick, and I've had to take some of the medications for pain, and you get nauseous, you get, I mean, for me, you get constipated, there's so many symptoms, and I don't like the way that I feel. Like, I hate taking pain medicine.
Well, people like to feel out of it.
Well,
They like to be zoned. That's why they're taking, you know, the way they
Right.
do the stuff.
But if you don't like that, obviously,
like me.
then I'd rather do
then
marijuana.
this is probably a much better option, and there's really no addiction potential with medical marijuana.
Do you think this will eventually, the hospital will be giving this instead
They
of?
are.
They are.
They are.
They're doing it?
Yeah, that's what you say, yeah.
They're using
dispensary.
it. They're using it for their cancer pain. Their
Yep.
cancer unit.
Yep.
They were telling us that they use it as adjunct therapy, and it also helps with appetite. It helps with nausea. I mean, I would imagine they're probably still using opioids at some level, but they're probably using a lot less.
Yeah.
Yeah.
Wow.
So.
Well, we are ready.
Already, yeah. I'm sorry about me. I have a very bad sinus
Yeah.
infection, so just excuse my sniffling today.
Okay, so then now you know all the information. We will be doing this again, I'm sure, because I'm sure people will ask more questions and want to know more about the medical marijuana, but we are ready for you. Thank you so much, Dr. Midelton, for getting certified to be able to do this. And we are,
Yeah, we're gonna tie up a little early,
yes, because we started so late.
and I'm not feeling well. So.
Gina is not feeling well. So we want to thank you as always for watching us, for giving us your time that we know is valuable. Thank you so much, and we'll see you next week.
Don't forget to like us.
Yes. Bye-bye.